Hello and welcome to Good Life, the health show with me, Priyadarshini Medhi. Well, this is a show that focuses on providing with solutions to your health-related issues, lifestyle and much more. Well, we have with us today Dr. Kasturi Bhattacharjee, a renowned ophthalmologist with a distinguished career in the field of eye care. Dr. Bhattacharjee is the only eye doctor of Assam and Northeast India to have a double FRCS in ophthalmology and to be an alumnus of the prestigious Harvard Medical School. Well, currently she is serving as the director of Sri Sankaradeva Nethralaya. Well, worth mentioning here is that Dr. Bhattacharjee has won more than 50 national and international awards and is the only woman of India to receive the 3 highest accolades in academic from the largest ophthalmic society, the All India Ophthalmological Society. Well, she was one of the few ophthalmologists in the world to receive the DCERT Fellowship Award from America. So, welcome to Good Life, Dr. Bhattacharjee. Thank you so much for joining us this afternoon.
It's a pleasure being with you today.
Thank you. So, Doctor, now my question to you, well, being one of the leading ophthalmologists in the country, you deal with innumerable patients on a daily basis, isn't it? So, taking in regard your immense experience, well, what are some of the most common eye diseases you encounter in your practice and what steps do you recommend for their prevention and early detection, Doctor?
Yeah, that's a very pertinent question. Like when you ask me the most common cause of blindness, one very important is age. Because we see there are multiple diseases related to age and the most common eye disease which is related to age is cataract. But along with it there are some other disease which may be related to age like something known as glaucoma or we have a very important layer in the eye which is known as retina with a central area which is known as macula. So, this is the main area which is responsible for the vision. So, with age sometimes what happens there is degeneration of these layers of the retina.
Right.
So, age related macular degeneration by name itself says age related. This is also very common and we see very high number of such patients. Another very important causes of blindness besides age is seasonal. I think you must be hearing about the red eye, the eye flu, the pink eyes, like lots of discussion going in the social media. Like this is a conjunctivitis which can occur due to multiple cause, which can be due to allergy, it can be due to infection, which can be both a bacterial and a viral infection. But what is really emergency is the accidents, like the road traffic accidents, and because of it, there may be different damage to the eye. Sometimes it so happens that the whole eye might get ruptured, but the most important sometimes because a trivial injury out here, the main nerve, the nerve which connects to the eye and the brain, then nerve gets damaged and there's total loss of vision.
Right.
And besides this, if you ask me other common condition, I should say one very important is systemic like diabetes. Diabetes itself leads to diabetic retinopathy which can lead to blindness or hypertension, that is a high blood pressure. That can also lead to a hypertensive retinopathy. But you know in Northeast I should add one more common, that is a regional I should say. This is a requirement for the periocular rejuvenation.
Okay.
So nowadays if you look to the number of surgeries, the lid surgery in Northeast, because this is a regional indication I should say, because in Northeast we have a different Asian type of lid configuration. So that also hampers some amount of functional activities of the eye. So that has also become a common requirement. I should not say disease, but a procedure which comes to us for the treatment.
So, Doctor, you know, as you already mentioned about conjunctivitis, well, we all know that there is an epidemic of conjunctivitis in India currently, isn't it? So, can you suggest some ways to avoid contracting this infectious diseases?
Yes, because you know a very important is very good personal hygiene.
Okay.
So, if you look to the spread of any disease which leads to an epidemic or whatever it is, it can be direct or it can be indirect. Direct means it might come from airborne, it can be the droplet infection, but conjunctivitis is basically a fomite. It spreads through the fingers, through the hands. So, you should always avoid touching the eyes, number one. and even if you touch something, you need to wash your hands regularly.
Okay.
So if you really maintain a very good personal hygiene, the chances of developing or the spread of conjunctivitis is much less.
Right. And doctor, you also earlier you mentioned about road traffic accidents. So as you already mentioned that road traffic accident can lead to irreparable blindness. So can you share an instance where you successfully treated patients in a similar case?
You know, this is something I'm really passionately working on it, because when you look to the road traffic accidents, basically it occurs to those young children who are in a very productive phase of the life. And many a time these young boys, I should say, they'll ride the scooty or the motorbike without any helmet. So that is very important. Like here I'm getting an opportunity to tell all this young generation that whenever you ride any two-wheeler, please put on the helmet. Why I'm telling you? Because okay, some of the injury is very obvious. There may be cut here, cut there, that can be repaired.
Right.
But sometimes if you are not with your helmet, a very trivial injury either in your scalp or in the side of the eye, it can damage the nerve, and this nerve is known as optic nerve, which connects the eye to the brain. So any trivial injury can damage to this nerve and can lead to total loss of vision. So all these years, like there is no very specific treatment for this condition. So I really wanted to help these children, and since you are asking me about some instances or examples where some of the patient recovered, so what I had done, I had started a very innovative surgical technique wherein we try to reach this nerve which is within a canal. But how do we reach? Because this nerve is very much near to the brain. So we bought a GPS system which is known as a navigation system, and with under the guidance of this navigation, we try to reach the nerve and decompress the bones, which is, I mean, giving the pressure on the nerve.
Okay.
So this is something I'm very happy to share with you, that now this condition can be treated to some extent by a surgical procedure. And very recently, I have published also this in a very prestigious journal known as the British Journal of Ophthalmology. Okay. And today, the world has realized that yes, there can be a surgery, a very minimally invasive surgery, which can be done by an eye doctor in order to help this children suffering from different types of road traffic accident leading to blindness.
All right. Doctor, thank you so much. We'll come back to you, but now it's time for a very short commercial break. So viewers, don't go anywhere. I will discuss more with Dr. Kasturi Bhattacharjee. As you already know, today we have with us in the studio well-known doctor, Dr. Kasturi Bhattacharjee. So I'll be right back with this very short commercial break. Stay with us. All right, welcome back. You're watching Good Life, the Health Show with me, Priyadarshini. All right, so as I've already mentioned, today I have with me Dr. Kasturi Bhattacharjee. So, doctor, now I would like to ask you that, being the director of Sri Sankaradeva Nethralaya, would you give us some insights on the procedures and services that the institute is currently providing?
Yeah, if you look to our institute, this is the only tertiary eye care center in Northeast India, and basically we have three pillars.
Okay.
One pillar is for the clinical work, one is academia and research, and the third is community. So we need to, what I feel that whatever each one of us is because of the contribution, the help, support from each person of the community. So I always believe that whatever we are today, we need to give back to the community. So I'm very passionate in working for the rural population of Assam, where what we have done, like we have tried to adopt some of the villages. We have adopted around 1800 villages to make them free from avoidable blindness. I will come back to this again, but if you look to the other two pillars, the clinical, this hospital has got all types and techniques for different surgical procedure. As I have already mentioned, that the most common surgery is cataract.
Right.
So for cataract, we have different ways of operating, and all these facilities are available. And these facilities are always developing. Why? Because we need, this is only step towards precision. So we have a normal basic cataract surgery to a very high end cataract surgery, which is a laser dependent cataract surgery. So, this is the only center where we have the femtolaser assisted cataract surgery.
Okay.
And plus I have already mentioned that we also do lots of surgery related to eye cancer. I would also like to mention that eye cancer in Northeast as a whole is pretty common.
Yeah.
So, we need very specialized instrument to do a reconstruction, because when you remove the eye you need to reconstruct, because it really affects the self-esteem of an individual. So, we have a very dedicated retina services where we cater to all the retina procedures and the retinal disease. Along with it we have other specialties like pediatric for childhood.
Okay.
So, these are the main clinical wing of us, but what we believe that along with clinics we need to go with research and academics. So, this is a postgraduate institute. We also have a paramedical courses, which is I mean the bachelor course. Now very recently we have also started with a master's course, and also we are planning to start the more higher courses. So, we have done lots of researches and also we had done a good number of publication. So, the three wings, one is clinical, one is academic and is a community, which I will again come back to you in details.
All right. So, doctor, now you have mentioned that periocular aesthetic rejuvenation requirement is very high in Northeast. So, you were one of the first surgeon to introduce facial aesthetics and reconstructive surgery in Northeast India. Your initiative was a boost to the aesthetic medicine infrastructure of the region. So, how is the reception and awareness from people regarding this?
Yeah, I feel when we talk about aesthetics, like I always like to differentiate it from cosmetics. Aesthetic is a requirement to enhance the self-esteem.
Okay.
So, it is very common that nowadays we find even in a young generation elderly patient, many people they come to us with multiple issues related to the face and most important eyes. And if I tell about the eyes, we all know that the eyes are the window of the soul. So, everyone wants a very, very fresh looking eyes. And one very interesting, if we look to the lids, eyelids in Northeast, most of the people do not have this crease.
Yes.
So, it's known as a single lid fold. So, many of these ladies especially they come to me, and madam, I would like to have a double crease, and that surgery is known as blepharoplasty. And today blepharoplasty has become a most common aesthetic surgery done not only in India, but one of the most common. But if you look to the Southeast Asian countries, it has become the most common surgery. So, these are some of the procedures, and along with it you need to do, like, you just cannot do one segment. If you want to give a good aesthetic look, you have to make them have a good skin, you have to make them a more rejuvenated and young looking. So, there are different aesthetic procedures that are being done in a hospital. The most important, me being a oculofacial aesthetic surgeon. So, we do surgery related to eyelid, related to the brow, the lower lid. And it's so interesting nowadays, we get patients coming from the other states. We also get some celebrity, like I should say Bollywood celebrity, coming to our institute for the aesthetic lid surgeries. And also along with the surgery, we do other procedures which are known as the injection dermal fillers, and also the botulinum toxin, which is very routinely given. The Botox that is given is not only for aesthetic indication, but also functional indications. So, I always feel that all aesthetic procedure has a functional component, and all functional procedure has an aesthetic requirement.
All right. So, doctor, now coming back to discussion on cataracts, cataract is very common. So, why is cataract so common, and are there any ways to avoid the disease?
Yes, as I have already mentioned, the cataract is the most common cause of avoidable blindness. If you look to the origin of the cataract, like the hair, the lens and the skin, embryologically it has developed from the same ectodermal linkage. So, say when we grow old, the hair becomes white, the skin undergoes changes, exactly the lens also undergoes changes, and this lens change that we have when we grow old, this is known as cataract. So, cataract cannot be, you cannot give drops or you can get rid of the cataract. The only way of getting rid of cataract is surgery. So, there is no other solution to it. If you have cataract, you need to undergo surgery.
Okay.
There are situations, sometimes it's so sad, we see children born with cataract. So, we have something known as congenital cataract, which comes the children being born with a cataract.
So, is that curable, children born with cataract?
No, that also needs to be done surgery. The earlier we do, it is better, because if the cataract is there, it will not help in the growth of the vision, it will not help in the growth of the eye. So, it will lead to a lazy eye, which in medical terms we call it amblyopia. So, the cataract is due to multiple cause. It can be a congenital cause which occurs in children, it can be due to trauma, it can be due to systemic, but the most common cataract is age related. And if you have a age related cataract which really hampers your normal day to day activities, you need to undergo the surgery.
All right. So, there have been numerous accolades to your name. So, you are the first Indian to hold the position of President in Asia Pacific Society of Ophthalmic, Plastic and Reconstructive Surgery. You have been published in numerous international journals as well, and you were recently featured in an article published by Harvard Medical School. So, doctor, tell us what motivates and inspires your journey.
Yeah, I always feel like I passed my masters in ophthalmology way back in 1996. So, when I passed at that time in 1996, I was a mother of 2 daughters. So, at that time I was very confused. I was confused that whether I'll step back and take care of my daughters, or I go ahead with my career. Then I have realized that motherhood is a journey, it is not a destination. So, that is how I have developed it. Along with my family, I need to go ahead with my career and also try to learn and come and give back to my state, to my country.
Right.
So, like as you have mentioned, yes, I am the first lady FRCS of Northeast. So, when I went to Edinburgh for my Northeast for my FRCS examination, and when I have passed in all the examinations, and it was so interesting. That was my first visit to UK. I never had any training in UK. I just wanted to go there to know whether the education that we have in Assam, is it of international quality.
Right.
With only that concept, I have gone to UK to directly sit for the FRCS examination. So, when I took the examination and passed my examination, then I got a job there.
Okay.
So, and I was so excited, because here my salary was very meager. And when I got the job in UK, so my flight was after 4 days, my return flight from UK to Guwahati. I called up my husband, I called up my my mother, and the only thing they told that, I told them, I got a job. They done nothing doing, you come back and work for the people of Assam. And can you imagine, my flight was after 4 days, but since they told come back immediately, next day I preponed and I just came back. Only to listen to my husband, to listen to my mother, and also it is true, you need to learn, you need to educate yourself, and you should have the knowledge, but you should come back and give it back to your own people. So that's how my journey started. Then as I was growing up, like I started from an associate, junior consultant, associate, today I am the director. Then I have also had multiple training, both nationally, internationally. I was trained in Calgary, that is Canada, in US, and that is how I kept on my journey, maintaining both my career and also my family life. And very recently, yes, I have become the chairman of one of the biggest society in India, which is known as the Oculoplastic Society of India. Then I became the first lady Indian to be the president-elect of the Asia Pacific Society, and that is, I should thank each one of you for blessing me and for me to reach in this stage.
Right. So, Dr. Sri Sankaradeva Nethralaya has established several integrated people-centric eye care centers across the region, isn't it, to reach the last man in the last mile. So, can you shed some light on what is IPEC and how will it help make our community free of avoidable blindness?
This is something, as I have already mentioned, I am really passionate about it. Okay. When we first started a community service means we do a rural service where we go to the villages, we screen the patient and bring back to a hospital and do the operation. That was way back in 1996. So, when we have started this project, we have adopted like we were going to the villages and bringing the patient. Then 2014 we have started something, a new project, and we thought that let us adopt some village and make them free from avoidable blindness. So that is how we had selected Sonapur, because Sonapur will be approximately 30-35 kilometers from Guwahati, so that even though it is a semi-urban or rural area, if we get the patient from there, easily we can transport back to the base hospital and we do the surgery.
Right.
So when we selected Sonapur, we found that there are 178 villages. So we had worked from the ground level, and the only intention was to involve the, to enhance the local buy-ins, to involve the local people. So we have taken local people's help, made them aware of different types of avoidable blindness. Along with it, we had also made them aware of the immunization and those pregnant ladies about antenatal, postnatal care, how to take good care of the general health. So we started educating the people. So within a span of 4 years, that the 178 villages became free from avoidable blindness. So when you call avoidable blindness, the most common cause of is cataract, and next is the refractive error, like the children when they do not see, they need the thick glasses. So this is condition known as refractive error. So we could make this all 78 villages free from avoidable blindness, and then the then governor of Assam, his Honorable Jagdish Mukhiji, he also came and he has declared all these villages free from Assam. So this is something very interesting, and now this model, what we have done, we have started also teleophthalmology, that is like telemedicine we have done. We have done a green village project, we have also done a green plantation. So we are trying to holistically develop all this village, and now we are extrapolating the same data and the system to other villages of Assam. And till date, we have adopted 1804 villages to make them free from avoidable blindness. So that is what I always believe, that we should try to reach the unreached, and it is very important that to reach these people you need the local help. So give them authorship and whatever ownership, and if you want to have such project, it should be sustainable. So the Sonapur project that we have found it to be a very sustainable project. So this is how we are trying to eradicate avoidable blindness in the whole of Assam.
Great initiative, Dr. Kasturi
Bhattacharjee,
I must say. So thank you so much for joining us this afternoon. So all right, that's all we have in this episode of Good Life. Keep watching Northeast Live, and thanks for watching.
Thank you.